Photograph the treatment area. Before starting the treatment, take photos of the area to be treated. Turn on the device and swipe card. Prepare materials before operation. Both the operator and the customer should remove any metal accessories. Wear gloves and disinfect the probes. Covered with a disposable facial towel. Wet the towel with purified water to 2/3 of its surface. Heat the cream on the probes. Spread the cream. Spread the cream evenly over the area to be treated. Step 1. Move around. Choose the dredging mode and adjust the level according to the customer's comfort. When performing meridian dredging, remember to apply slow, deep, and steady movements so that the pulse energy can penetrate into the meridians and body. Muscle groups of the upper arms. Introduction script. Introduce the muscle groups of the upper arms. Discuss the potential health risks associated with poor circulation in this area. Provide a diagnosis and highlight how these issues impact the customer. Emphasize how this relates to specific service packages. Loose and weak upper arm muscles can disrupt the arm's curve, affect arm movement, and easily lead to shoulder inflammation. Feel the strength and tension of the upper arm muscles. Use 2 probes simultaneously to massage the upper half of the upper arm muscle groups back and forth for 3 to 5 times. Muscle groups at the back of the neck. Introduction script. Introduce the muscle groups at the back of the neck. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. Tensions and stagnation in the muscle groups at the back of the neck can press on blood vessels, causing dizziness and headaches, exacerbating nasolabial folds and neck wrinkles. 1 probe should be placed on the upper arm or the dishui point, while another probe is used with slight pressure to push the muscles at the back of the neck back and forth for 3 to 5 times. Feel the tension in the muscles and check for nodules or cord-like structures indicating stagnation. Trapezius muscle. Introduction script. Introduce the trapezius muscles. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. Tensions in the trapezius muscles can disrupt the shoulder curve, causing broad shoulders and a thick back. It can also lead to shoulder and neck pain and stiffness, compressing the cervical nerves and blood vessels, resulting in headaches and migraines. Use dual probes to push the trapezius muscles with slight force, moving back and forth 3 to 5 times. Feel the tension in the muscles and check for nodules or cord-like structures indicating stagnation. Pectoralis major muscle group. Introduction script. Introduce the pectoralis major muscle groups. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. Tensions in the pectoralis major muscle group can cause rounded shoulders and hunchbacks, limit upper arm movement, and contribute to shoulder problems. 1 probe should be placed on the upper arm or the dishui point, while another probe is used with slight pressure to push the pectoralis major muscles back and forth for 3 to 5 times. Feel the tension in the muscles. Second step, locate. Switch to the stretching mode and adjust the intensity level based on the customer's comfort. Activate the acupoints. Dishui de Jianzhen, Jianzhang Shu a Bingfeng, Yunmen a Shenkang, Yunmen Jiao Rong. Each acupoint should be held for 30 to 60 seconds. Interact with the customer to assess the flow of energy through these points and provide a diagnostic assessment. During the process of activating the acupoints, introduce relevant scripts for blocked acupoints. Explain the role of the acupoints. Explain the health risks related to poor circulation in these acupoints and outline the health problems that the customers are experiencing. Dishui, the switch for the body's yang energy, acting as a hub for qi and blood. If this hui is blocked, yang energy does not ascend properly, leading to the accumulation of turbid energy, which can result in fatty deposits at the base of the neck. Jianzhen, a junction for qi and blood. If Jianzhen is blocked, shoulder joint pain and shoulder issues follow. Jianzhangshu, an important point on the small intestine meridian. If Jianzhangshu is blocked, it can easily trigger back and shoulder soreness, coughing, and bronchial inflammation. Bingfeng, where four yang channels converge. If Bingfeng is blocked, it can lead to scapular pain, arm numbness, and difficulty raising the arms. Yunmen, a crucial point for promoting lung qi. If Yunmen is blocked, it can trigger coughing, chest tightness, and shoulder problems. Jiaorong, an essential point on the spleen meridian. If Jiaorong is blocked, it can result in fullness in the chest and ribs, coughing with breath reversal, and inability to bend forward or backward. Shenkong, an essential point on the kidney meridian. If Shenkong is blocked, it can induce insomnia, vivid dreams, coughing, wheezing, and chest pain. Third step, clear. Switch to the moxibustion mode and adjust the intensity level based on the customer's comfort. Clear the acupoints. Dizhui Jianzhen, Jianzhangshu a Bingfeng, Yunmen a Shenkong, Yunmen Jiaorong Ashi. Each acupoint should be held for 30 to 60 seconds. Based on the specific conditions of the customer, interact to check if there are still any tender or blocked points. Discuss the potential harms and impacts, guiding them towards appropriate service packages. Step 4. Circle. Switch to pure heat mode with zero intensity. Perform circular motions over the treatment area for 2 to 3 minutes to soothe the muscles. For first-time customers, you can extend this soothing time. Guide the customer to notice the improvements in their body. Real-life examples of successful treatments. After the treatment, take photos of the treated areas and compare them with the before photos. A single device can serve as a performance center for various establishments such as wellness spas, Thai massage parlors, and orthopedic massage clinics.